Hey everybody, DJ Porkchop hanging out with you for video number 2 this Labor Day evening. Hanging out in DJP Studios. What we'll be talking about this evening for video number 2. Went and seen my neurosurgeon. This could be a back update. Went and seen a neurosurgeon. Been trying to get an MRI since like June. The stimulator that I have installed was MRI Montage. It's a couple few years old now. It's pretty much outdated, but it's still a good unit. Fully MRI compatible. Issue is nobody will take me. I've heard every excuse known to mankind. The machine will hold up to 400 pounds, which I will fit. But the problem is they're like, you're a big brawny guy. You know, and they even use that stupid voice. Like, I don't understand, right? You know, you're big at the shoulders, you know, big fella. I get that. Okay, I get where you're coming from. I'm too big, right? So they just don't want to deal with it. Other places, their equipment was too old. They couldn't get the settings just right for safety reasons, this, that. I was even told, oh, we can do it. But we don't have a doctor on site, so we don't want to do it. Well, if you went out of your way to make sure you have equipment capable of treating such patients, why are you afraid to do it? I digress, but whatever. But I'm not going to argue it out. So I ended up doing a myelogram, and that 3-letter test where they shock you. EEG, EMG, whatever them G's is, I don't know. Last time I got it done, showed very severe nerve damage. This time, everything worked out great. What I got going on is I was born with something missing in my spine. Basically, there's an old term everyone says, you're off your rocker, and I've brought this up before. You're off your rocker, people say. Cuckoo, right? That's not what that means. Your back is only meant to bend one way, pretty essentially. You can go this way, but it's only meant to go one way. So it meant to rock forwards and backwards. Well, yeah, I'm not a doctor, I don't know. This way it's explained to me, but there's a bone missing in my back that's allowing my spine to like shift wherever it essentially wants to go. And it's moved again, shifted again, and let pressure off another nerve, but in the process, the myelogram indicated that there was 2 more super duper really ruptured discs, and Doc pointed everything out on the images, and it was pretty wild. I mean, I never bothered asking him before, and he pointed everything out, and that was pretty wild what all he was showing me and talking with me about. And I think he sat in there with me for probably 25, 30 minutes, and we talked, and he said essentially there's, you know, shots. We're going to have to do shots no matter what for the inflammation, naturally. He said, because even if you did surgery, and he knew my answer to that right off the bat. He said, because even if we opt for surgery, he said, your insurance company, we've been through this before, they require a full set of injections to bring down the inflammation prior to going in the operating room. So he said, level 2 fusion, which I already have an L5S1, and my answer was, no, I'm not doing that. I could still get up and walk. The stimulator is still doing its job. I have no sciatic nerve pain in my legs. I don't want to throw up whenever I take a step. I can still get out of bed, walk, go take pictures in the woods, some days suck really bad and it hurts. I got a walking stick. I call it the bullshito cane. If anybody gives me any bullshito, I just beat the holy hell out of them with it. You got to get you one of those. I'm telling you right. But anyway, yeah, I ain't even 50 years old yet. Level 3 fusion. That's not sounding appealing. My wife would have to take too much time off of work to help me to get through the initial first phase of it in the hospital and at home, and no, there's too much stuff going on right now. I just can't do it. So on top of the whole cancer deal and this and that, nope, not gonna happen. So we've been leaning on the old stimulator quite a bit. It does, you know what? It really doesn't, and it's never helped with mechanical pain for me. It does my nerve pain though, obviously enough. But what I like to do is kick back and recliner a little bit, because anybody who's got a stimulator knows you can manipulate it. You learn how to manipulate it when you move, you stretch. Even if you have it set on a no feel feeling, you can stretch and you can feel it. Well, I have my favorite setting that I like. I treat it like a Ronco rotisserie. You set it and forget it, right? So I have my favorite setting, and then I can just get there and get myself to see right there. I can feel it right there. And I just hit that little spot, and it's just like almost like a massage, just laying there in the old chair, kind of like my buddy Joseph Borg says, kind of like a cat. Whenever they start purring, they do that purring thing, laying on you, which is kind of awesome and feels good. So, yeah, kind of do one of those. I'm not doing the whole pain pill thing. They're a pain in the ass to get. Frankly, I don't want to. If I'm eating pills all the damn time, if my grandbaby comes over, then I'm automatically obligated for safety reasons not to hold him. I don't want to take a risk in being drowsy and drop him and hurt him. I don't want that. So I'd rather hurt a little bit, and sit down and be able to hold my grandbaby, enjoy him, and just not be Fruity Loops when the boy's here, and not only him, but my daughter and, her boyfriend, my wife, or whoever else comes over. I don't want to be all pain pilled up. I don't want to be. But that's my prerogative, though. And there's nothing wrong with, there comes a point in time where there's dealing with it, and then there's suffering. I'm not all for a person letting himself suffer. Trust me, I don't. There's a point in time in the day that's a cutoff. I'm like, well, you know what? There's a good chance the kids aren't coming over this late. And if I have to have an active script at the time, I'll go ahead and take a pain. If not, a couple Tylenol, which they don't work anyway, but whatever. You get where I'm coming from, right? It's just being smart. But that's what I got going on in the wonderful world of spinal cord stimulator. I'm still going on strong, still working. Update on the back. What's they always saying? It gets worse before it gets better, right? I keep telling myself that. But like I just said in my last video, I got a local buddy here. He's a diver, Chaos Divers. Check him out at chaosdivers.com. He doesn't sponsor me to say that, doesn't ask me to say it. His name's Jacob. He's a really cool fella. He's good at quote. Just keep diving. It's not worth it to stop. And I'm quoting him, by the way. I'm not stealing his line. And I said that in my last video, too. Check him out on Facebook, by the way, too. Really awesome guy. Ever since I heard that man say that, now with all this crap going on around me and with myself, I think about that every single day now whenever I wake up. Just, don't give up. Tomorrow I'll be here. If the sun comes out, or even if it's raining tomorrow, we'll give her another try. So with that, I'm going to shut up and get on here. I appreciate all 5 of my viewers. tuning in tonight. You all know who you are. I appreciate each and every single one of you. I don't take any of you for granted. You know anybody who's looking for a, you know, and any, you know, send them by. Let them know they're not living this by themselves. You know, we're all in it together. If you need a kind word for the day, hopefully I got something kind to say. You know, hopefully if I need something, hopefully you'll pick up on that in one of my videos and drop something in the comments below. Who knows? But we're all in together. Take care of yourselves, everybody around you, and by golly, we'll give her a try again tomorrow. Take care, everyone. See ya.